Welcome to the Heart Rate Variability Podcast. Each week we talk about heart rate variability and how it can be used to improve your overall health and wellness. Please consider the information in this podcast for your informational use and not medical advice. Please see your medical provider to apply any of the strategies outlined in this episode. Heart Rate Variability Podcast is a production of Optimal LLC and Optimal HRV. Check us out at optimalhrv.com. Please enjoy the show. Welcome, friends, to the Heart Rate Variability Podcast. I'm Matt Bennett, and I'm here today with a very special guest. I read the paper about a few days ago, reached out, and so I'm so glad to talk about a paper that combines two subjects that I love talking about. One is workplace stress. The other is the combination of biofeedback and mindfulness. And this article brings those two things together. So I want to welcome Dr. Adrian Low to the show. Dr. Low, before I start to nerd out with you about the amazing paper you published, why don't you just introduce yourself and a little bit about how you learned and got interested in heart rate variability?
Right. I appreciate you for having me here, Matt. My name is Dr. Adrian Low. I'm a psychologist based in Hong Kong. And about 10 years ago, I was actually working with organizations that were struggling with employee stress. But, they were measuring it with questionnaires from the 80s and the 90s, So tools that didn't really capture what was actually happening in the employees' bodies. So then I thought, what if we use heart rate variability as an objective measurement? So I ran a study with 85 employees, and what I found was fascinating and puzzling because some of the data doesn't make sense at all, which led me to dig deeper, to the cultural factors, and emotional regulation. So that earlier research set me on a path that eventually led to combining HRV biofeedback with mindfulness, which is the work we're discussing today.
Awesome. So let's talk a little bit about workplace stress in Hong Kong, where your study was completed. What are some things that are showing up in the workforce, through the study or just through what's happening in the culture? I know in the U.S., burnout is still relatively at an all-time high. We may have gone a little bit down, since the post-COVID highs, but we've gone down a little bit, not to a pre-COVID level. So I would just love to see, just to hear what you're seeing in Hong Kong and some of the things that may have you found out during this study as well.
Yeah, that's a really great question because, I would say, from my opinion, Hong Kong professionals, they are some of the most stressed people in the world. I'm talking about people, working in finance and
Yeah.
law, healthcare, tech, these high pressure jobs where you're expected to work long hours, and never complain and just keep going, And culturally, the Asian culture, there's this expectation that you gotta hide your stress. You don't talk about it. You just push through, right? So here's the thing, as a psychologist who studies stress, the stress doesn't disappear, it builds up in your body. And we just wanted to find a way to actually help these people so in a way that
Yes.
felt culturally acceptable. So that's where our study came in.
And I'm curious, one of the things I have a real passion for workplace health, wellness, and performance. And your study was like written to me personally. I loved it, how you combined this. I'm curious the reception you got from your subjects. Obviously high stress situations, but hey, we want to study HRV. I'm just curious kind of what the response was from your subject.
Yeah, that's a really great question because the thing about the Asian culture, particularly Hong Kong, that's a really, really important because that's a strong norm, that we should hide our emotions. So in a way, we are being stoic. I think that's the word. You have to be tough, So emotional restraint is seen as a high sign of maturity in the Asian culture. So so therefore, when we do the study, we have to frame it, instead of saying let's work on your emotions, so we frame it as like a professional skill, So we say things like, how about let's develop emotion awareness, for better decision making. and or how we can help you to perform better under pressure. So these are some examples that how we
Awesome.
frame the language, to make sense to the Hong Kong professionals. And I believe that not just Hong Kong, but all over the world as well, right? So instead
Yes.
of talking about healing or therapy, we talk about optimization and performance.
I love it. I love it. I'm curious with your this kind of a little bit of a sidebar question, but in a culture that the norm is emotional suppression, I wonder your work as a psychologist. How does that sort of show up in counseling and psychology? Do you see this repression having a middle around anxiety or depression? I'm just curious how that might show up in a counselor's or psychologist office in that high achievement, low emotional expression situation.
Right. It's interesting because in my earlier research, some of the fascinating results that was found was the two of them. One is when heart rate variability goes up,
Hmm.
your emotional stress goes up as well. So that was
Mm,
counterintuitive initially. I mean,
yeah.
in the probably in the US culture, that would definitely be counterintuitive. But in Hong Kong, it makes sense because people, as I mentioned, they mask their emotion. They don't actually express it. But the very people who express it will be healthier. So therefore, it's a positive correlation. HRV, just to make it, layman, you can think about it as like optimal health. So a
Yes.
healthy person goes up, right? Emotional expression goes up as well, right? So
Yes.
with this finding, when I share with my clients, they get it, and then they will, start to, bring down all the barriers of masking emotion. They start to talk more about it.
I love it. So let's talk about a little bit about the planning for the study itself, because you combine two things that I love. And as our listeners know, our work with Dr. Ina Hazan, we talk a lot about mindfulness and biofeedback. But I'm curious, as you were putting this study together, some people just do biofeedback, other people just do mindfulness. I personally love that you combine these two, but I'd love to just as you were designing this, what was some of the thought processes to bring mindfulness and biofeedback together as an intervention for work stress and burnout?
So first of all, when we look at mindfulness, it's basically, we pay full attention to the present moment without judging what we're experiencing. So in the study, what we did was we used the four main practices. So in mindfulness, there's a very classic, the body scan meditation where you slowly move your attention through your whole body, just noticing the sensations. And you do things like focus breathing, you focus your attention to your breath coming in and out, and also open monitoring, right? Where you sit and watch your thoughts come and go, and just like clouds passing by in the sky. And also the mindful movement, like gently stretching, while staying aware of what your body is doing. So I think in a nutshell, biofeedback will be more of, how we work with our body, which is really important as well. But on the other hand, mindfulness it actually deals with how we work with the brain. So therefore,
Yeah.
it's kind of like a mind body, experience in it altogether. So so let's talk about the study. Yeah. So
Yes.
basically, my study we had 100 Hong Kong professionals. So we split them into two groups. So group A, group B, yeah. So group A, they basically just did HRV biofeedback with probably just a very normal kind of breathing. I mean, not normal in the sense that we teach them how to do like in a minute 5 to 6 breaths, deep
Yeah.
breathing, belly breathing, right? And they can see for themselves, how their body reacts to what they have just done. So basically, Group A just did this, and they used the device and they learned the breathing techniques. The example we have just shown you. Well, Group B, they did the HRV biofeedback plus the mindfulness. So in fact, they did everything which the Group A did, but they had a structured mindfulness sessions. So both groups, did the protocol for 8 weeks, and we measured them again at the final the final week was the week number 8. And what's interesting is 6 months later, we measure them again.
I love that about the study.
So,
Yes.
so what's the result? Now, group A and group B, both groups improved. So that's the good thing to know for both groups. HRV biofeedback works wonders alone. But group B, the group that got the biofeedback plus the mindfulness, improved significantly more. So let me give you some numbers.
Awesome.
So basically, HRV, we look at the value, you think about the value like the overall health score. So group A, they just did the biofeedback alone, plus very normal breathing. They improved by 22%, right?
Wow.
And their relaxation ability improved by 31%. Their heart rhythm coherence. Coherence, you can think about it like the symphony, the symphony, the integration between your left and right brain, as well as your heart. Or it can be a symphony between your sympathetic and parasympathetic system, and you can see, they have improved their heart rhythm coherence by 14%. So that's group A. Now for group B, their overall health improved by 53%, and
Wow.
their relaxation ability by 67%, and their heart rhythm coherence by 32%. So you can see the group B kind of like double, what group A has done in some of the areas. So, but I think what's really important is these improvements didn't go away. 6 months later, Group B still had most of these improvements. Their heart
Mm.
health was still 51% better than their baseline, and
Wow.
their relaxation ability was still 63% better. While Group A, the improvement faded a little bit, but they're still better than baseline, but not as much as right after the program. So therefore, as a kind of like a principle we can draw out of this experiment is brain training is really important, to to trigger long-term results. While
Hmm.
while biofeedback with the body training, you would get result right away, right? But you need a combination of both, so that you can have longer lasting results.
And did you see any difference? You mentioned a couple different types of mindfulness. I know my audience would be curious of the protocol that you use. Was it just the users could choose, or the study participants could choose which activity they wanted to do? Did you have sort of a, hey, do this one on Monday, this one on Tuesday? I'm curious how you set up the mindfulness protocol for folks.
Right. So basically, let me just draw out the agenda, the mindfulness agenda. Um, so you can see the group B, they receive almost everything. They did what group A has done. On the other hand, they had a structured mindfulness practice. So for 8 weeks, right? And the session length was approximately about 45 to 60 minutes per session. So weekly structured sessions, and they do it sometimes they do it at home as well, daily home practice for 20 to 30 minutes. So for the brain training, so what they learn was they 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 learn about the body scan meditation, which I kind of like talk about just now.
Yep.
And so that took about 8 to 10 minutes, body
Okay.
scan meditation, right? So basically what they did was we get them to lie down, or they can sit comfortably, close their eyes, and feet apart, hands resting on the lap, and take 3 to 4 deep breaths. And after that, we scan from their foot, attention moves from the left foot, right foot, no judgment, and followed by the leg, and slowly they move up to their torso, to their arm, to the head, and finally the whole body.
Awesome.
So, so this works really well because a lot of these stressful employees, they are very disconnected with their bodies, So by doing that, they can separate, these different elements, and slowly, through the focused attention, it activates, their parasympathetic system, right?
Mhm.
And then they also have emotional awareness, like where the parts of the body having the tension, or the suppressed emotions, So basically, we train their attention and non-judgment.
Yes.
And after that, the next practice would be what we call the focused breathing meditations. And again, we allow the subjects to sit comfortably, close their eyes, and and we allow them, to have awareness of their breath, notice their natural breath, like, and just observe it, something like that. And where do you feel your breath most clearly? Where is it, at the nostril, the chest,
Mhm.
at the belly, and then we allow them, to choose one location and focus there, and maybe, during the process, their mind would wander, and we tell them that, hey, it's normal, minds will wander. And when you notice your mind wander, just slowly bring it back to your breath. So the breath as the anchor, right? And 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 by doing this, what really happens in the brain is we actually activate their prefrontal cortex, their thinking brain being engaged, their default mode quietened down, the mind wandering would slowly, turn off. And so it's kind of like a muscle, that's being trained. The amygdala is
Yeah.
being calm, the fear center becomes less reactive. Vagal tone increases, which is the parasympathetic, right? And because most stressful people have racing mind,
Hmm.
and so therefore uh it's part of what we teach them, can do it anywhere, where sometimes, when they are at the pantry, when
Yes.
they are walking to the washroom, they can do it, so again, the cultural aspect, especially for the Asian culture, is we instead of telling them, hey, let's meditate, let's
Yeah.
find your inner peace, but we frame that. We tell them, let's train your attention like an
Mhm.
athlete, how an athlete train your body, or instead of saying, let's connect with your spiritual self, we say, let's develop your mental clarity and focus for better decision making, so managers, the leaders, they love these jargons,
Yeah.
this, right? And finally, we also help them to develop a meta awareness, like um, and what we call meta awareness is the awareness of awareness. And the
Mm.
aim is to reduce the emotional reactivity. So basically, how it works is we instruct the participant to sit comfortably, close their eyes, natural breathing, body relax, and we tell them, hey, now we're going to practice open monitoring. Instead of focusing on one thing, we're going to notice everything that arises, So imagine your mind is like the sky. So your thoughts, your emotions, the sensations, they're like clouds passing by. And obviously, we're not trying to create a cloud, but we're
Yeah.
we're not trying to stop the clouds. We're just watching them pass, right? So when a thought arises, like I'm stressed from
Mm.
work, or maybe there's a thought about work, so we teach them not to engage with it. Don't push it away, and on the other hand, not to engage with it. Just watch it like a cloud passing by through the sky. And maybe an emotion arises. I feel anxious, and just notice it and say, that's anxiety. So we're teaching them how to label that feeling. Where do you feel it in your body? Is it your chest, your stomach? You just observe it, right? So when there's a sensation that arises, like, hey, my back hurts, so just notice it. Oh, that's back pain, just label it, that's back pain, right? Don't try to fix it, just observe it. So thoughts, emotions, sensations, they would just arise and passing by like the clouds in the sky. And so so by teaching them, it actually develops a habit, for them over the 8 weeks, and we teach them that thoughts are not facts. So although they're stress, it's just a thought, but it's not the reality, right? So in a way, we help them to detach, right? Um, and 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 this is really revolutionary for Hong Kong professionals, because most stressful employees, they are identifying with their stress, like I am stressed,
Yeah.
So so by doing this technique called open monitoring, we frame that to be, I have stress, but I'm not the stress, right? So
Mm.
this creates a psychological distance from the stress. And in other words, it will reduce the emotional reactivity, right? So this is the third protocol that we teach them. And finally, there's what we call the mindful movement. So we integrate the body awareness with movement to
Mm,
develop a somatic intelligence. So this takes about 5 to 8 minutes. And uh, so for the first part, we would allow them to stand, right? They stand, feet and hips, the feet and hip apart, knees slightly bent, arms at the side, eyes open, a soft gaze, and we tell them to notice what does standing feel like, and after that they can do the neck rolls, slowly roll their head in circles, very slow, and we tell them to notice what do you feel in your neck, and we do the reverse direction, not forcing, just gentle awareness. And after the shoulder roll, right, so from the head again we go down, very slow movement, like where's the tension, where's the ease. So it's kind of like the muscle relaxation, progressive muscle relaxation from the head towards the
awesome.
toe. And they'll do the spinal twist, very slow, controlled movement. How does your spine feel? And after they do the forward fold, slowly bend forwards from the hips, let their arms hanging, their knees can be bent, you know. And what do you feel in your hamstring, your back, your neck?
Mhm.
So this is body awareness, doing movement, right? And this is really important, especially for stressful employees who have very tight, tense body. So these mindful movements would release their tension, while they build their awareness. So in a way, it teaches the employees to be aware while they're moving, right?
Yeah,
So I
love
think
that.
that's basically what we did. These four techniques. It's basically a very foundational,
Yeah.
and enough, for them to cover during these 8 weeks.
And it's really kind of a nice gift to the reader of your work too. Is if I were going to like pick for foundational mindfulness activities, you pick those. Like it's I would say now mindfulness can look a lot of different ways to a lot of different people, but the clouds, the progressive relaxation, all those are like great because they were mindfulness 101 to really give that comparison. So let's talk about the biofeedback aspect of this. Was
Sure.
Yeah, I'm sure you had one group just doing HRV biofeedback. Talk to me about the mindfulness group. Were they doing biofeedback while they were doing mindfulness? Was that in addition to the mindfulness? I'd love to hear and have you share how you structured your control group and then the experimental group as well.
Yeah. So basically, I think the measurement, the how we set the procedure is basically the same. It's the content, in the middle that's different. So it's kind
Gotcha.
of like you get a baseline HRV, right? And after you do the protocol, whether it's the brain part, or the body part, and after that you do a post test, right? So that's how
Okay.
you capture the pre and the post. So you do that for consecutive 8 weeks, and especially the final week, you do it again, and we can compare the baseline and the final, and even like 6 months later, we can compare.
Excellent. So the biofeedback folks, like what would their did they tell me about them? Like, well, what was their protocol in this besides the pre and post? Was there anything happening in between those or
Right. So I think for both groups, because both groups actually experience the biofeedback.
okay.
So I think what's really game changing is that especially in the Hong Kong culture, that because Hong Kong culture is heavily influenced by Confucianism,
Mhm.
and we
Yes.
emphasize a lot of social harmony,
Yeah.
face saving, emotional restraint, not burning others with your prompts, so if you're stressed, don't talk about it. You don't show
Yeah.
up. You just keep working. You stay composed, right? So basically, when we use the biofeedback, so um, we actually ask them, how do you feel about the protocol or the program? So one of
Hmm.
them actually said, we actually noted down, and I'm paraphrasing what he said. He said the HRV biofeedback felt safe because
Mm.
it's
Yeah.
technology. It's technology. It's
Yes.
objective.
Yeah.
It's not admitting I have a problem, you know. I'm just optimizing my performance. So I
Yeah.
think that's a key insight by framing it as a performance optimization instead of stress management, you know. People felt comfortable engaging with it. So it didn't feel like therapy or asking for help. It just felt like training.
Yeah. That's awesome.
And for the second group, you know, mindfulness added another layer because one of them said, and this really stuck with me because he said something like, the mindfulness helped me to realize that I was allowed to feel stress.
Mm.
And noticing it didn't mean I was weak. So that's really profound because for their entire, you know, career, you know, professionals were taught that noticing stress equates to weakness, you know. But mindfulness actually teach them something different, like noticing your feeling is awareness, and that's intelligence and that's strength.
I love that. So I would love to hear just kind of put this in the context, this great study into your career and working with heart rate variability. I'm curious, sort of, when it got on your radar, how'd you get fascinated in it? I'm just kind of curious about where this article and heart rate variability fits into Dr. Low's career as looking at your bio, very successful, and just I have to ask how all this sort of fits into your career and evolution.
I think for this research, I think it's just a starting point, and I'm happy, you know, to share what's my upcoming project as well. So for
Yes.
this project, I think I think I've said it just now, but let me just rephrase that again, for the sake of, you know, clarity, right? So this research actually, you know, help us to think of our stress response as having two parts. One is our body, because our body
Mm.
has an automatic nervous system, right, that controls our heart rate, our breathing, our digestion. So when we are stressed, you know, the system gets stuck into go mode, you know, fight or
Yeah.
flight, you know, and your heart rate will stay high, your breathing will get shallow, and your body just keep pumping out the stress chemicals, right? The cortisol, right? So the HRV biofeedback works on this system directly, you know, for the on the body. So when you breathe slowly and watch the feedback on your device, you literally can retrain your body's autonomic nervous system. So it's like saying, hey, it's okay to calm down now, right?
Yeah.
So it's kind of like a bottom-up regulation. You're starting from the body and working upward. And after that, we work on the next part. So because a lot of, you know, people using HRV, they just work on the body part, but
Mm.
they neglect the brain part, right?
Yeah.
So so when we talk about the brain, you know, especially the thinking, you know, the decision
Hmm.
making, that can also control the stress. So when
Yeah.
you notice your emotions without reacting to them, you know, when you focus your attention to the present moment, when you think about things differently, you're actually using your brain to calm down your body. So therefore, mindfulness actually works on this system. And you
I
know,
love.
mindfulness has been around for quite some time. It's just that we didn't really use it. We didn't really combine it, you know, with
Yeah.
the biofeedback, right? So therefore, yeah, mindfulness works on the biofeedback system. It trains our brain to regulate our emotions and control attention. And after doing the mindfulness, we do the HRV, and you see the values goes up and it stays there, right? So
I
I think
love it.
this is what's happening at with this research. Now, what's really interesting is in my upcoming research, which already has been completed and
Oh,
just
awesome.
been accepted, you know, by you know some journal. I'll share that with you later once it's published.
Great.
So basically, with HRV data, we can also associate to the subject's pain,
Hmm.
the parts of the body that's feeling pain, right? And so what we realize is, you know, a lot of work workplace employees, you know, they have pain in the body, especially the upper body area.
Yeah.
So yeah, so that's an insight because upper body we have like the shoulders, the neck, the spine, and all that. So it's interesting. We can pinpoint the exact location, you know, where their pain is being located. And so this is my upcoming project as well, which is once we got it sorted out, the next step is we can come up with a predictive model, right? So now that the research has completed for the pain and HRV research, I want to revisit these data like a year later, right? I want to
Mhm.
see whether the pain has intensified further,
Yeah,
because by the pain being intensified further, it will give us an insight that is more of a predictive measurement.
I love that. I love that. Any other future ideas? Because I mean, one of the things I'm very interested in is how do we get this, whether it's Hong Kong, whether it's here in Denver, Colorado, how do we get burned out, stressed out workforces to integrate these models so they can get the benefits that you've shown in
Mm,
your study? I'm just curious if you've had any thoughts on that, because that's one of the hardest things to get
right.
off the ground
Uh,
is, and that's
I
where I
think
loved your research. So,
I think we're in really exciting times right now with AI, you know,
yes,
getting better and better. So what I really want to do is to integrate, this predictive model with the AI,
I love
right?
that.
So once, so you can imagine like a year from now, when we take the HRV reading and the AI, would analyze based on past records, and it will come up with a report. Okay, so your HRV is showing that you are suffering from, quite a high stress, and because of that, if you don't do something about it, your shoulders will start to be painful, your left or right, whatever. and
Yeah,
and and I think that would be a game changer because nobody wants to feel pain, right? And therefore it would motivate them to start the protocol to
yeah,
intervene right before it's too late.
awesome. Awesome. Well, this has been a great conversation. I will put the link to the paper in the show notes, so people can check that out. It is, I encourage anybody listening to this to do that. I can't wait for the next paper to come out. Pain and HRV is one of our reoccurring topics here because of how biofeedback has been effective for that in really exciting ways that may be alternative to medication and taking pills and other things. So
Absolutely.
I will right now invite you back when that research gets published. I'd love to do a deep dive into that as well because it's one of the most important topics we cover.
Wonderful.
Awesome. So we'll put information about Dr. Low, the research in the show notes, which as always you can find at optimalhrv.com. And Dr. Low, thank you so much for your work, your time, and for our audience, we'll see everybody next week.
Thanks so much for having me. I really enjoyed the conversation.
Thank you.
Okay.